Hi everyone, welcome to our presentation on liver cancer. Liver cancer is a disease where cancerous cells develop in liver tissue. This growth disrupts one of the most essential organs in the body, affecting critical functions. First off, let's take a step back and recall these critical functions. This includes 1. Detoxifying our body. Secondly, producing bile to help digest fats. Third, supporting immune functions. Fourth, storing essential nutrients. And fifth, regulating blood and hormones. So, when liver cancer develops, it starts as an uncontrollable growth of abnormal liver cells. These cells multiply rapidly, forming tumors that impair these vital processes. As liver cancer advances, it significantly disrupts our body's overall balance and health, underlining the importance of early detection and treatment. Okay, so types of liver cancer. The most common type is hepatocellular carcinoma, or HCC, which develops in individuals with chronic liver damage, such as from cirrhosis. Next, we have intrahepatic cholangio carcinoma, or bile duct cancer, known for being challenging to detect early, as often it doesn't show symptoms until it has progressed, making it harder to treat. Thirdly, we have hepatoblastoma. While rare, it is the most common liver cancer found in children, and it is associated with certain genetic conditions. And next, we have angiosarcoma, and that is a very rare and aggressive liver cancer with rapid growth and spread, making it particularly dangerous. Lastly, we have fibrola malar carcinoma, and that is a subtype of HCC which features fibrous scar-like tissue around the tumor cells. Now, my partner will talk about the causes and risk factors of liver cancer.
The immediate cause of liver cancer is unknown. Studies have indicated that it can be due to oral estrogen, androgens, or environmental exposure to carcinogens. Risk factors include scarring of the liver, excessive alcohol intake, chronic smoking, hepatitis B virus, hepatitis C virus, malnutrition, obesity, and family history. Signs and symptoms of liver cancer include dull, aching abdominal pain, unintentional weight loss that can progressively become anorexia, nausea, vomiting, itchy, fever, fatigue, along with back pain. And for physical findings, a person may be experiencing jaundice, dependent edema, enlarged liver, enlarged spleen, ascites, and they may be having white chalky stools. For labs and diagnostic testing of the liver cancer, it's going to be the liver function test, which is going to be abnormal. Another lab done would be the alpha fetoprotein, which is also going to come back as abnormal. They're also going to do a bilirubin test along with the albumin test and the prothrombin test, which is all going to have decreased level. For the alpha fetoprotein, it's going to be greater than 400 micrograms. And then for the imaging done for liver cancer, it's going to be MRIs, CTs, and they also do a screening for the liver, which is indicative of the lesions in the liver. For diagnostic procedures, they're going to do a biopsy, which will reveal any cancerous cells.
Treatment for liver cancer depends on the stage of cancer. These treatments include removal, transplant, chemotherapy, medical procedure, and in some cases, radiation. Liver resection is a surgical procedure performed by laparoscopic or robotic surgery to remove a cancerous tumor from the liver. It is usually done in the earlier stages of cancer where there is one tumor less than 2 centimeters in size and the tumor has not spread into the vessel of the liver. Radiation therapy or chemotherapy may be done before surgery to reduce the cancer's size, make the operation easier and safer, or improve the chances of curing cancer. Liver resection has the best survival rate of all options. Liver transplant is a treatment for early stage cancer when there is only one tumor 5 centimeters or less in size or up to 3 tumors that are 3 centimeters or less. It is not an option if cancer has spread to other parts of the body. About 75% of people who undergo liver transplant live for at least 5 years. Chemotherapy can be used to treat cancer. This includes chemoembolization, where a combination of drugs and small particles are injected into the blood vessels that feed the tumor, starving the tumor of oxygen and nutrient. Hepatic artery infusion, HAI, injecting chemotherapy drug directly into the hepatic artery, is often more effective than traditional chemotherapy. Targeted drug therapy uses man-made antibodies to attach to a specific target on the tumor. These drugs are designed to prevent the tumor from forming new blood vessels. Radiation therapy can be used to treat liver cancer by destroying cancer cells with high-energy rays and particles. These treatments include EBRT, SBRT, and radioembolization. The success rate of chemotherapy and radiation therapy depends on the stages of cancer, the type of treatment, and the patient's own response to the treatment.
So some preventions and lifestyle changes that you could do to help decrease your risk of liver cancer is to maintain a healthy weight and also working out. Another thing is also to stop smoking. Smoking is very bad in the body and also is a risk factor for other cancers as well. Drinking coffee can prevent liver cancer. The reason behind this is that coffee has natural antioxidants that can protect the liver from inflammation and damage as well. And studies have shown that drinking at least a cup of coffee a day can decrease your risk of liver cancer by 14% than those who don't drink coffee. So that was really interesting to read about. Getting vaccination against hepatitis B and getting tested for hepatitis C is also very important because hepatitis B causes liver cancer, and unfortunately we don't have any vaccination against hepatitis C, so it's just very important just to rule hepatitis C out. Avoid food that has aflatoxin like corn, peanuts, dry food, and rice because these type of toxins or mold can cause liver cancer because it could spark or change the cancer. So some tips is just to throw out any food that has mold or looks abnormal or discoloration because you don't want to risk that. The last important thing is to get screening done annually because liver cancer symptoms can go unnoticed. So it's just very important to just get that tested out.
Current research and future directions of liver cancer include the importance of prevention. Current research for liver cancer includes screening biomarkers, proton therapy, and sorafenib with TACE. So currently there is a biomarker that's already being used to detect liver cancer, which is the AFP protein. And researchers are looking at other types of proteins that can be used to detect liver cancer in its earliest stages. One of them includes the PERK, the DCP, and the glypican-3 protein are all being used currently to see if there's an actual detection of this type of cancer. Proton therapy is already being used as a treatment for liver cancer as well, but currently research are making the improvements to precisely improve the treatment. And what does this mean? Researchers are trying to spare the destruction of the healthy liver cells and only attack the liver cancerous cells. Sorafenib is already a medication that's already being used as well, but what researchers are trying to do is use it with adjunct with transarterial chemoembolization, which is TACE. And what this this treatment and this medication will do together is block the blood flow that allows the tumors to grow. Another treatment that's using future directions include viral therapy, and viral therapy is being used, and they're using a specifically genetically modified virus known as the JX594, which would specifically have the mission to only target the liver cancer cells. In conclusion, we know that liver cancer starts off with the genetic structure of the cell, and we also have important risk factors that we should share with the community, such as smoking or drinking alcohol or having any type of illness of the liver. And we also have prevention. How do we prevent liver cancer, right? No alcohol, no smoking, of course, and maybe vaccinations to prevent hepatitis. And we also have current treatment options that are being used, such as chemotherapy and radiation therapy.